Hello and welcome to today's presentation. I'm Dr. Motahare and today I'm going to talk about renal colic and kidney stones. I'll cover everything from the causes to symptoms to diagnosis and treatment options and most importantly, preventive strategies. My aim today is not only to explain the science behind these conditions, but also to provide you with practical clinical useful insights for both healthcare practice and also patient education. So let's dive in. Let's just start with the definition. What is renal colic? Renal colic is a type of pain which is severe, sudden, and often colicky. It means that it's not constant. It just comes and goes. This is not constant pain, but very severe. That is caused by obstruction of urinary flow, most often due to some kidney stones. It's naturally felt in the flank, but can radiate to lower abdomen and groin as the stone moves down the urinary tract. What are renal stones, also known as kidney stones, urolithiasis, or nephrolithiasis? They are solid deposits of minerals and salts that form in the kidney. Common types include calcium oxalate or calcium phosphate, uric acid, cystine stones, or struvite. These vary in their risk factors, radiological appearance, and also preventive strategies. The hallmark symptom is a really intense flank pain, which comes in waves. This pain can radiate to lower abdomen, groin, or genital area, depending on the stone's position. There are associated symptoms too, like nausea, vomiting, hematuria, that means the presence of red blood cells in the urine. That can be microscopic, that means that we just can see under the microscope in the lab, or macroscopic. It means that your urine is red, gross hematuria. If the stone is just lodged in the lower ureter, you can also sense some urinary urgency, frequency, things like a simple urinary tract infection. You also have some kind of autonomic responses like sweating, pallor, or restlessness, all because of that intense pain, very intense pain. Stone formation occurs when the urine becomes supersaturated with some minerals, leading to crystal formation and then growth. Key risk factors include low fluid intake and dehydration, the most important one, high sodium and animal food intake, diet rich in oxalate containing food, some metabolic disorders like hyperparathyroidism, recurrent urinary tract infections with certain bacteria. Some of the drugs can cause urinary stones too. But one of the most important one is genetic predisposition. It means that when there is family history of kidney stones, the probability of these stones will be much more higher in the persons in comparison to other persons without family history. The diagnosis of kidney stones begins with a true medical history, asking about the pain quality, onset, duration, location, radiation, other symptoms, urinary symptoms, past episode, family history. And also, if you are suspecting to any other problem, we'll ask about symptoms of that problems too. Then we will do a physical exam and then ask for some lab tests. The tests that are used for urinary tract, just urinary tract stones, are a simple UA, urinary analysis test, that we are looking for the presence of red blood cells, increased cells, infections, and many other things. Blood tests also may be ordered for evaluating the renal function, like creatinine and BUN. We may ask for the level of calcium, serum calcium, or uric acid. Then we will go for imaging studies. Mostly the first-line imaging study is a simple sonography. It's easy, cost-effective, and without radiation. But it has also some limitations, like it cannot detect very small stones, or stones that are present in special locations in the kidney, or stones that are from some kinds of materials. They will not be clear in the sonography. So if we have all the equipments, we will use non-contrast CT scan for the first line and use ultrasound imaging for children and pregnant women that we don't want to radiate them. Non-contrast CT scan of abdomen and pelvic area is the gold standard for detecting and also measuring the size, accurate measuring the size of the stones. Other modalities also present, like X-ray KUB. This is a kind of X-ray that can detect radio-opaque stones but may miss uric acid and also other radiolucent stones. But altogether, we should also rule out other possibilities that cause this kind of severe pain. All depends on the patient's history and presentation. The initial management of renal colic focuses on pain control because of the intensity of the pain. Different drugs, opioid and non-opioid drugs, can be used based on the situation. And also other drugs can be used to relax the ureter muscles in order to help the stone to pass away. But if these initial treatments fails, or there is some kind of complication of that stone, like there is a stone here and an obstruction here, completely obstruction, and an infection is superimposed on that obstruction, this is a real emergency. Or not, it's not an emergency, another condition, another situation. Like what? Like patient has kidney stones for a long term, and these stones didn't pass away by themselves, and gradually they become larger and putting pressure on renal parenchyma, and gradually they are affecting the renal parenchyma. They are reducing the renal function. We should do something for that. We cannot wait until that one day they will just go by their own way. Larger stones will not go away by themselves. And also smaller stones that are located in some places in the kidney cannot pass by themselves sometimes. All depends on the patient situation. So if the primary pain killing interventions did not work, or there is kidney stones with complications, we will think about other methods to get rid of these stones. One of them is extracorporeal shockwave lithotripsy, ESWL, which mostly used for small to medium-sized stones located in a good part of kidneys, not all parts. The other one is ureteroscopy for stones that cannot be broken with ESWL or are in difficult locations. And other modalities also we have, like percutaneous nephrolithotomy for large complex stones, and maybe other methods too. That is a urologist specialty. Based on the patient's condition, situation, altogether, they decide what to do. Prevention is key about renal stones, because The recurrence rate is high. What are the preventive strategies? Increase the fluid intake. As much as you produce at least 2 to 2.5 liters of urine per day. Reduce your sodium intake as much as you can. Reduce animal protein consumption. Maintain a normal dietary calcium intake. This calcium will be helpful. This calcium will bind to oxalate and do not let that oxalate to absorb to your body and lead to kidney stones. Limit oxalate-rich foods such as spinach, nuts, tea, chocolates, lots of them. If you search on the internet, there is a long list. But it's not mandatory to reduce all of or to just not consume any of these foods. No, just consume these foods as much as needed and also eat calcium enough and also fluid enough. Altogether will help you. It doesn't mean that you should not drink tea at all. No, just in a normal amount. The other one is increase dietary citrates by eating more citrus fruits like lemons, limes, or oranges. Maintain a healthy body weight and avoid excessive sugar sweetened beverage, because these are high in oxalate too. Patients with recurrent kidney stones should do some tests and be evaluated for some metabolic disorders. Maybe this is not just making stones by the kidney, something's promoting this condition. So if there is recurrent kidney stone, we should do a complete evaluation for other underlying disorder that can lead to recurrent kidney stone formation. Thanks for your attention. Renal colic and renal stones are common, painful, and sometimes serious. But with timely diagnosis and also appropriate treatment and prevention, the outcome of the patient can be improved, significantly improved. I hope this session has been informative for you, and also you can use this information in your daily life. Please, if you like this video, subscribe to my channel and also like the video. And if you have any question, just please let me know, put it in the comment, and I will answer all of them. Stay hydrated, stay healthy, and keep learning. Thank you.